Hey there, I'm Dr. Francis with Injury Care Centers, and today we're going to talk about exercises for low back pain. And first I want to tell you, I'm not giving you any medical advice. If you have low back pain, then you should seek out a licensed professional that can help you and do your own research. Now with that out of the way, let's go ahead and get into our first exercise for low back pain. And these exercises were actually designed by a professor of spine biomechanics. He came up with these 3 exercises, or actually 5, that really help with generalized just low back pain on a day-to-day basis. So the first one we're going to do is actually called a cat camel, or a cat cow. I call it a cat camel. So the first exercise that we're going to do is actually really not an exercise, it's more of a stretch. And what we're going to do is we're just going to sink our low back down into the table like this and bring our head up into an extended position like this. And then we're going to come back up and bring our head down and you want to tighten your abs and pull your abdomen up like this and try and get a good stretch. And we're going to do that about 15 to 20 times, right? So we're going to go up and down and up and down. Good. All right, now the next exercise after you get done with those that I want you to do is that you're going to actually lay on your back and we're going to do what's called a curl up. So what this position is you actually lay on your back like this, and you're going to take your hands and you're going to put them in the small of your back or on your lumbar spine right here. And you're going to put one knee bent like this, and we're going to do 10 reps with each knee bent. So first we're going to start with our right knee bent, and the goal is to not actually push with your elbows down, but to actually just kind of lift off the table about 1 inch. So we're just going to lift off the table 1 inch and hold for 2 seconds and then down. And then we're going to come up and down. Good, just like that. You can see I'm really out of shape here. So we're going to do the other leg now. We're going to just bend this one up just like this, just like the other side. After you do those 10 or 15 with that other leg, you're going to come up and do the same thing with this leg. Okay, now after you've done those exercises, the next thing that we want to do is going to be a side bridge. So with a side bridge, it's important. There's different ways to do it. So if, as a beginner, you may want to start with your knees in a bent position or your flex position like this. And the goal is actually to get your knees and your hip and your shoulder in a straight line. So you want to have them in a straight line. So you want to look at your posture before you do this. And if you have shoulder pain, then you want to actually, you can reach around and grab your shoulder like this and kind of create a little bit of tension in your shoulder. So then you're going to actually just come up off the table a little bit like this, and you're going to hold, and you're going to do that 10 times with each side. So remember, so you're going to do 10 times with your left. And if you're a little more advanced with it, you want to make sure that your ankles, your knee, your hip, and your shoulder are all in a straight line. And you're actually going to, if this table is big enough for me here, so we're going to come up off the table like this, and you're going to hold for a couple seconds and back down. And do that with both sides. Then the last exercise that we're going to do today is actually going to just be a front plank. And I'm sure you're all familiar with a plank, but it looks like this. So you go onto your elbows and your knees are bent, head up. So you want your head and your thoracic and your lumbar spine all kind of pretty much horizontal or level. And you're going to just come up onto your toes and hold that for about 2 to 3 seconds. So up, 1, 2, 3, and down. And we're going to do that about 10 to 15 times as well. And that's pretty much it for today. So if you have low back pain, try doing these exercises, once every day or once every couple days, and see if that doesn't help. And if you still have back pain after that, give us a call at Injury Care Centers. We can help.